Okay, this presentation is going to be on mindfulness-based cognitive therapy. It was written for and created for clinical advocacy with individuals for the social work department at King University. Okay, introduction to MBCT. So mindfulness-based cognitive therapy will be at the center of this presentation. Mindfulness-based cognitive therapy, MBCT, is a combination of cognitive therapy and contemplative practices. This was stated by Cooper and Lester on page 172. It requires an array of principles to treat those battling with diagnoses from depression to anxiety. This evidence-based practice was at the center of the role play for treating Maria and her major depressive disorder. Mindfulness-based cognitive therapy was created by John Teasdale, Zindel Siegel, and Mark Williams. They originally designed mindfulness-based cognitive therapy to treat those battling with depression. This therapy has many principles in order to accomplish a successful recovery. Okay, so this slide is going to touch on 3 principles of MBCT, and those 3 principles include self-awareness, self-acceptance, and cognitive reframing. So one of the main pieces to mindfulness-based cognitive therapy is being mindful, which encourages self-awareness. The concept of mindfulness is derived from Eastern meditation practices. Mindfulness is where one is in the moment and accepting thoughts as they come without judgment of oneself. Various tools may be used, and these tools are going to be coming from Sipe and Eisendrath, and the tools include various formal and informal meditation practices, including guided body scans, sitting and walking meditations, mindful movement, 3-minute breathing spaces, and focused awareness on routine and daily activities. These various mindful activities are going to help the individual calm their breathing, which then helps them recenter themselves as they become more self-aware of their physical and mental body. And as they become more self-aware, it gives them insight into their thought process, and what might lead to their depressive symptoms and their depressive thinking. A technique also used in mindfulness-based cognitive therapy is going to be derived from the CBT side of this therapy, and that is going to be psychoeducation. So this technique can help an individual learn self-acceptance, which is a principle of MBCT. So psychoeducation is used in therapy to educate clients on their diagnoses. Some of the information provided to the client may include the cause of the diagnosis, symptoms of the diagnosis, possible treatments, and risk of relapsing to former symptoms. So providing this education can give the clients greater insight into the things that they may not understand about their diagnosis or even how it developed. This is going to be a key principle, as the focus is going to be to create a self-accepting environment. And as the client understands their diagnosis and the development of it, they're going to be better able to accept themselves. It also encourages the client to stop blaming themselves and really focus on how to better manage their symptoms. Mindfulness-based cognitive therapy also uses several other interventions from cognitive behavioral therapy that promote its various principles. And these interventions from CBT might include cognitive and behavioral interventions such as behavioral activation, recognition of negative automatic thinking and warning signs, and establishing a maintenance plan. And that comes from Lilja et al. But by using these interventions, another key principle of MBCT is used, such as cognitive reframing. Cognitive reframing is used to reshape a client's thinking to encourage more healthy thinking patterns. This can especially be beneficial for those that battle with anxiety and depression as they're reshaping some of those thoughts that they have. Okay. Mindfulness-based cognitive therapy is an evidence-based practice, and it has been used to treat diagnoses such as depression and anxiety, and it has been shown to be effective in treating those two diagnoses. Okay, so this is one of the many studies that can be found on using MBCT to treat depression or even anxiety, and it is by Burgess et al. It's a brief mindfulness-based cognitive therapy MBCT intervention as a population level strategy for anxiety and depression. So this whole slide is going to be based off of the statistics provided in this study. So roughly 61% of individuals actually saw a reduction in depressive symptoms. So if they came in for treating their depressive symptoms, 61% of them saw a reduction in those symptoms. Roughly 50% of individuals that received MBCT for depressive symptoms entered treatment remission. Roughly 66% of individuals saw a reduction in anxiety symptoms. And then roughly 40% of individuals that received MBCT to treat their anxiety actually entered treatment remission. So the demographics provided from the study is that the mean age for this study particularly was 47 years old. Roughly 57% of the group was female, roughly 32% male, and roughly 2% other. 77.8% were Caucasian, 3.7% Asian, 1.9% Black, 1.9% Hispanic, and 5.6% other. So although it does provide the demographics of the study, it does not provide us with the success rate for each part of the demographics. So it wasn't the success rate for certain age groups were not provided, as well as if it was seen more effective with males or females. None of that was really given in the study. But overall, they did see a high success rate. It looks like about 2/3 saw a symptom reduction, and then between 40 and 50% actually got to see enter treatment remission. Other studies that also found MBC to be promising included mindfulness-based cognitive therapy, primary care patients' experiences of outcomes in everyday life and relapse prevention, Lilja et al. 2015, mindfulness-based interventions for anxiety and depression, Hoffman and Gomez 2017, and mindfulness-based cognitive therapy in patients with depression, current perspectives, McKenzie et al. 2018. There are many techniques that mindfulness-based cognitive therapy uses to treat individuals. In the role play, two specific techniques that I use was psychoeducation and teaching a mindfulness activity. Since mindfulness-based cognitive therapy has been used to treat those that battle with depression, I thought this would be appropriate for Maria since this was her diagnosis. The psychoeducation technique from mindfulness-based cognitive therapy seemed appropriate in treating Maria to provide her with a greater understanding and to eliminate any shame that she might feel from receiving this diagnosis. And then McKenzie et al. Actually describes the way that psychoeducation is provided by stating that MBCT contains elements of CBT, such as psychoeducation about the role of cognition in depression, and exercises to illustrate how one's thoughts, emotions, and behaviors induce and maintain depressive symptoms. So this technique was overall just used to really help Maria understand the effects of depression, how depression is formed, and what she can kind of do to overcome it. And then this was just to help Maria kind of see that the development of major depressive disorder, it was not her fault. And this then in turn created an accepting environment. And once there was that accepting environment and that understanding of her diagnosis, then we were able to kind of start with the mindfulness technique to then give her tools that she can use at home to start overcoming some of those symptoms. And the mindfulness technique taught by me was the 4-4-4 breathing. So I was also, while teaching her this technique, I was also encouraging her to be open to her thoughts as they came in. And this technique is done by having the individual breathe in for 4 seconds, hold that for 4 seconds, breathe out for 4 seconds, and then hold breathing out for 4 seconds. So this allows the client a chance to calm their breathing. By calming one's breathing, more oxygen is actually going to be able to circulate throughout the body. And as the oxygen is now circulating throughout the body, it's going to be able to make you think more clearly, and you're going to feel more relaxed because you're getting all the oxygen you need. And Rizwana actually states that the therapy enhances the quality of consciousness with clarity and vividness of current experiences and functioning. When an individual has calmed their breathing, they're actually going to be able to better reflect on day-to-day living, from thinking habits to hygiene habits. And this is going to empower Maria by showing her that there are ways she can start healing the way she thinks, and start having a chance towards remission. So overall, I felt as though mindfulness-based cognitive therapy is a straightforward way in which it's applied. So this made me feel as though I did not have to second guess myself as much as I had in the past using other techniques. This also led me to feeling more comfortable, prepared, and I had a goal in mind of what we were there to accomplish that day, as well as kind of taking on what she had to say about her day. And then as for the client, the goal was to create a self-accepting, calming, engaging, and self-aware environment. I believe I did all right with this. However, there's always so much room to improve. And going forward, I do hope that I can better apply this technique. Overall, mindfulness-based cognitive therapy is an evidence-based practice used to treat individuals with various mental health diagnoses. These diagnoses include, but are not going to be limited to, depression and anxiety. Principles from MBCT that are used in treatment include self-awareness, acceptance of self, and cognitive reframing. From MBCT, the techniques used to treat Maria Lopez included psychoeducation and mindfulness breathing. These techniques were used to encourage self-awareness and acceptance of self for Maria. Here is part of the list of my references. And then here's the other half of that list of references. I just want to thank everybody so much for taking the time to listen and learn a little bit about MBCT with me.